Today for my health promotion project, I'm going to be talking about hyperlipidemia. To break the word down a little bit more so it's easier to understand, we've got hyper, which means elevated, lipid, which means fats, and emia, which means blood. So it's a high concentration of lipids in the bloodstream. It's also known as high cholesterol. And cholesterol is a soft, fat-like, waxy substance in our bodies. It is not inherently bad, as most of us tend to think. It's a misconception I think that a lot of us have. Our bodies use cholesterol to build cells, make vitamins and hormones, and we actually naturally our liver makes all of the cholesterol that is needed. Anything excess is where hyperlipidemia can come into place. So we consume this through saturated fats and trans fats. So saturated fats are things that become solid at room temperature. So things like the fat on a steak, whole dairy products, heavy cream, coconut oil, and things of that nature. Trans fats, on the other hand, are also a big contribution to hyperlipidemia. Those are going to be things you're going to find in fast food, pastries, sweets. You're going to find it in red meats and cookies, crackers, and things of that nature. So we have two kinds of lipoproteins in our body, and one is HDL. You're going to remember HDL, which is high density lipoprotein. So H you're going to think of as for healthy, L, which is low density lipoproteins, L you're going to think of as lousy. So H is healthy, L is lousy. HDL, again, carries the LDL back to your liver breaks it down and excretes it. So that's a good way to remember that. Another note is that triglycerides, you'll hear that word a lot, and that is the most common type of fat in our body. So going to the etiology of things, there's primary versus secondary. Primary is genetic, you're born with it. Secondary is acquired. So under primary, there's only one classification. It's called FH, which is familial hypercholesterolemia. Secondary is going to be all those things that you do, like a lack of exercise, sedentary lifestyle, smoking, drinking, and poor lifestyle choices and food choices. Other things that can also cause hyperlipidemia are some medications like amiodarone and glucocorticoids, as well as diseases such as hypothyroidism and uncontrolled diabetes. So moving along to the pathophysiology, which you see down here with my atherosclerosis artery, that's ultimately a combination of genetic and environmental factors is how hyperlipidemia happens, but it contributes to a person's risk for developing high cholesterol and cardiovascular diseases. So elevated LDL, which is your lousy, is the most prevalent risk factor contributing to atherosclerosis and vascular diseases. Atherosclerosis is a process of the artery walls to thicken and become stiff. So typically, we do not treat this until somebody becomes 70 to 80% occluded. So you have to reach that point in the vessel's diameter, that much blockage, for us to do a surgery on you, at least in the United States. This can lead to a complete blockage of the artery, which can cause heart attack, stroke, amputation, and that's due to peripheral artery disease. If you're not getting blood into those extremities, you're going to lose them. So to give you all the visuals and idea of what it looks like in our arteries, imagine this whole bottle as being your artery. Your artery walls are the outside of the bottle. Inside you got your plasma, which is your liquid. Red's going to be red blood cells, and the white's going to be our lipids. So in a healthy body, when I turn this over, the HDL can carry this LDL back to the liver for it to be broken down and then excreted. It's not too much. It's not too much for the body to handle, and it's natural. This is what we make naturally. So for an unhealthy artery, same thing, same concept. You're going to see a lot more lipids in there, and that's when it becomes uncontrollable, and those lipids actually will start sticking to the side of the artery walls, and that's where you start to become blocked and occluded. Your vessels are becoming more narrow, and it's making it harder for your body to function. So as far as diagnostics, the main diagnostic testing you can do is get a blood sample taken, which tests your lipids. You get a lipid panel, which is going to check your HDL, your LDL, your triglycerides, and your total cholesterol. And you have to do this fasted. So you are not supposed to eat or drink at least anything other than water for 9 to 12 hours for this test. The next thing you can do is if your primary care provider is still uncertain, there's a test called a CAC. It's a coronary artery calcium measurement, and that's done to determine the calcium buildup or the hardening, the stenosis and the hardening of the arterial walls. And that's done by a CT scan of the heart. Another thing that's really important for anyone that's getting a history on the patient is to obtain family history, the patient's diet, lifestyle, if they use tobacco, if they're a smoker, if they've been a drug user, what medications are on, do they have any other comorbidities, and a focused exam to listen to the femoral and carotid bruits with the belly or stethoscope. Stenosis, you're going to listen for an S4 heart sound, and you want to make sure there are pulses in all 4 extremities, because if there's not a pulse, we have a problem, and likely it's peripheral arterial disease. After the age of 20, this chart tells you, that's when you want to get your lipid panel done every 5 years, and that's if you are at low risk. If you are still at low risk at your 40s, your doctor's going to use a tool called the Ascvd risk calculator to calculate your 10-year projection of heart attack or stroke likelihood. So to go on to complications, which we have here, you're going to see things like stroke, heart attack, and the amputation, which we did talk about, coronary artery disease, peripheral arterial disease, CV accidents, aneurysms, type 2 diabetes, high blood pressure, and even death can be a consequence. There are 2 ways we can talk about treatment of this, and that is modifiable and non-modifiable ways. So modifiable things you can do in your life are going to be diet, exercise, smoking cessation, drinking cessation, weight loss, eating healthy foods versus unhealthy foods. So things you want to eat, and I have an example, are things like things with fiber in them. Gold key is Cheerios. It's always, the logo is always that it lowers cholesterol. Fruits and vegetables, we've got sweet potatoes, bananas, onion, anything I could just grab in my kitchen, eggs. We've got 2 different types of fish, and salmon's a really great one because it has those omega-3 fatty acids. Things you're going to want to avoid are red meats, processed meats, and things like bologna, alcohol, cigarettes, like I said before, any fried foods. Also, sweets are very high in them. And then things like mayonnaise and such. You're going to find lots of saturated and trans fats in those. So the other recommendation for exercise is 150 minutes of moderate intensity aerobic exercise a week. And then along with smoking cessation, if you're not a smoker, you also want to avoid secondhand smoke. So non-modifiable treatment methods are for those who have hyperlipidemia due to genetics. So there's cholesterol-lowering drugs, and the first line of defense when it comes to hyperlipidemia drugs are statins. A common one is Lipitor. We're then going to go down the list. The second most common is going to be a cholesterol absorption inhibitor, which is ezetimibe. We move down to ACL inhibitors, then bile acid binding resins, PCSK9 inhibitors, and then if you have high triglycerides instead of the high LDL, you're going to treat with fibrates, niacin or nicotinic acid, B3, they're all the same thing. And then you're going to treat with omega-3 fatty acids, which I got here too. So there are 2 mechanical options. In very stubborn cases, there's a cleansing of the blood called plasmapheresis, which quite literally takes the blood out of your body through an apparatus, throws out the garbage, puts the good blood back into your system. So the second is a partial ileal bypass. It's a shortening of the ileum, which decreases the total cholesterol by about 35%, but that's a very, very rare surgery, and it's typically only done if you have it genetically. To summarize things, as a future healthcare professional, not only is it great to learn about these various diseases and how they work in the body and how they work with other diseases and other organs in our body, it's really important to understand and be able to educate the patient and their families. It can help save lives. So if you don't know your family history, you need to find it. If you're over 20 years old, you need to start getting your lipid panels and get your tests done so you know if you're at risk. And then through primary, secondary, and tertiary interventions, ultimately, hopefully we can treat these patients and also prevent, which would be primary. Ask your provider if you need any help or clarification. And from the American Red Cross, I found this really great saying as far as hyperlipidemia goes. And the phrase was check, change, control. So you want to check your lipids. You want to change your diet and lifestyle in any way that you can, and then you want to control it. And inadvertently, you are going to control it if you do 1 and 2. So with that being said, I want to ask you all how you can manage your hyperlipidemia in your future. Thank you.